Eating, drinking, and speaking are all basic functions that many of us take for granted. It is well documented that problems with eating, drinking, and communication are associated with a reduced quality of life. Head and neck cancer and its treatment can have devastating consequences affecting these functions. Trismus is the reduced jaw opening, which can be the incidental outcome of surgery and/or chemoradiotherapy treatment for tumors in this area. In current practice, if a patient develops a problem with opening their mouth after they have finished their cancer treatment, the usual therapy offered is a program of exercises using a jaw stretching device called a TheraBite. Speech and language therapists working within the Head and Neck Cancer MDT have initiated a project where their patients commenced the use of a TheraBite before radiotherapy treatment started. The project encountered issues with recruitment of patients. Compliance with the therapy regime was also poor due to the high burden of side effects of the cancer treatments. The team learned that patients needed direct supervision and support to fully comply and benefit from the therapy regimes when going through treatment. It was also felt that there was a need to extend the follow-up period to ensure the effects of the regime were long-term. Starting exercises before and continuing throughout radiotherapy and/or chemotherapy can be a more grueling therapeutic route to take, appreciating the physical and emotional side effects of the cancer treatments that patients may already have to contend with. If preemptive interventions with appropriately selected patients are to be as successful as possible, the therapist should offer regular support during the cancer treatment phase of the exercise regime. Evaluation clearly demonstrates that early intervention does have a positive effect on mouth opening. It also reduces other symptoms that trismus can lead to, such as poor oral hygiene, dental caries, communication impairment, and swallow impairment. Improving jaw opening, therefore, can lead to a significant improvement in the quality of life for the patient.
Winning the NHS Wales Awards was a big moment for us, really. I think as speech and language therapists, we're not hugely recognised in terms of our profession. And it's had a real impact, the work that we've done has had a real impact on patient care. In terms of advice for other people who are thinking of perhaps doing some project work, I think there's never a right moment. The time would never be right. I think combining research or work like this with clinical practice is always going to be difficult, but it can have a real impact on patient care.